Hi, this is Sonia Liebendorfer. We're going to talk about the second part of Lewy body dementia today. And I wanted to give you this information so you can just kind of mull over it over the weekend because it's got a lot of information about support for you as well as support for your family member that has Lewy body dementia. And it talks a lot about the medications and the diagnostic tests and therapies and things that you can do to help with this disease. But it also goes into the tools that are needed for the caregiver because you have to keep your batteries charged. And we're going to have to go into ways that you can stay energized and stay on top of things whenever you have somebody that is becoming totally reliant on you for their care. Okay, so we said that you can't diagnose Lewy body dementia except on postmortem and an autopsy when they can do staining of the brain. So, how would you basically come to the diagnosis of Lewy body? Well, there's several tests that they can do to try to rule everything else out. And that's how they pretty much come up with a diagnosis. It's pretty much a given if a person has already had signs of Parkinson's for a while that it's just the disease progressing to other parts of the brain. But still, it's best to, number one, get a computerized tomography of the brain to rule out any strokes, any mass, anything else going on. It's also a good idea to get an EEG. What that is it's normally the 12 leads that they put all over the scalp whenever you have a sleep study, just to check and see about how well you're sleeping. They also can use it for people if they suspect seizure activity, if they suspect that a part of the brain is overactive, then they will use this particular test to see which part of the brain is staying excited and overactive. You can also use a MRI, magnetic resonance. You can also use that to check and see if there's any abnormalities that show up on the brain. There are particular blood tests that they can do to check and make sure that it's not a thyroid condition or it is not um, pernicious anemia, vitamin B12 deficiency causing it. They will specifically do neurological tests in which they will check and see how well a person can function doing everything from reading to simple math to simple memory tests and also tests on reflexes and stuff as well. And then there is one that they can do. I've never seen this done, but I wish they would use it more often, and that is the PET brain scan. It's like a special machine. It's kind of like an MRI, but not with all the noise, is my understanding. But they can actually look at the different brain scans and see if the dopamine is being uptake regularly like it's supposed to be. And I have never seen this test done, but I would love to see it done because to me, that is the most diagnostic that you would have out of all of these tests that we have here, even for Parkinson's, if it shows a problem with dopamine uptake. So that is the testing that they can do. And now we're going to go into the different medications that they can use to help control the symptoms. Now, medications can be tricky because the person is already on Parkinson's medications to relieve symptoms from Parkinson's. And those are kind of like a law of diminishing return because the more somebody takes, the less effect it seems to help. And so those can get very frustrating because it gets to a point where they really don't help with the symptoms as much as they aggravate the symptoms. Um, they also can put them on antipsychotics, But that's like a catch-22 too, because you only want them to be on them for a short period of time. You don't really want somebody to be on it for a long period of time because those things have a lot of side effects. And you can only put them on a second generation. You cannot put them on a first generation like Haldol. You have to put them on a second generation antipsychotic, and they recommend it only if it's just absolutely necessary and the benefits will outweigh the risks, because there are a lot of interactions that you have to worry about when you've got somebody that is on that much Parkinson's medication and then you start adding other stuff to it. Now, the other problem is if it's accompanying Alzheimer's. A lot of times it all accompanies Alzheimer's. And then you can add some of the Alzheimer's cholinesterase medicines. You can add Exelon and Razodine, but like I said before, with every medication you're adding, you have to take into consider the amount of side effects you're going to have to deal with. So those can increase the neurotransmitters in the brain to help them be more alert and be more have better cognition and be able to hold on to conversations and everything better. But at the same time, you don't want to get them to a point that it's stimulating their receptors too much because it can aggravate the Parkinson's symptoms too. So just be very careful with these medicines. Now, if it is severe dementia, then you can add Namenda to it, but by no means is Aricept supposed to be used, and that's according to the FDA with Lewy body dementia. If you have somebody that's trying to give your loved one Aricept with Lewy body, Aricept does not go with Lewy body, and it's not to be given with Lewy body. So that warning is there from the FDA. And so now let's go on to some therapies that we can use to help with care. Now there is a recommendation that if you can just tolerate the fact that they are hallucinating and seeing animals that aren't there and people that aren't there, and if that's something that you can tolerate, instead of putting them on a bunch of medications that have side effects, they recommend that you just tolerate it. Because once you start getting all the side effects of these medicines together, it can really cause issues with them having any kind of quality of life with all of the side effects all these medicines have. And that's really what is in the important thing is we want them to have quality of life for as long as they have left. You know, it's bad enough that Parkinson's is a progressive disease, and it's bad enough that it spreads to the rest of the brain. The Lewy bodies spread to the rest of the brain, but we want them to maintain as much of a quality of life as possible, and that's difficult to do once you start adding all these medications on board. So one recommendation is if you can just tolerate the hallucinations and you don't have to medicate for them because it's not something that really upsets them and agitates them, but it's just something that kind of soothes them and relaxes them, then that might be something you might want to take into consideration. Now, they highly recommend that you take control of the environment around them because any way that you can reduce clutter and reduce noises that are distracting and disturbing to them, the better off they're going to be. They also recommend that you don't try to correct them if they're saying stuff that's wrong because they don't realize that it's not them saying it. It is the disease of the brain saying it. So the person isn't actually wrong, it's just the way the brain is processing it is wrong. So don't try to correct them. And I know it's hard. I know it's hard. But you don't try to correct them. what you try to do is you try to offer reassurance whenever you can, and you validate their concerns if they say that they're concerned about something, but you don't ask them a bunch of questions. Now, I'll give you a good example of that. My mother, she has vascular dementia, but she was complaining a lot about one of the residents that she was eating meals with that never had a positive word to say. And she said she's really found it difficult to go to meals because of this person's attitude. So I listened to her and I told her that I would talk to see if maybe her seating arrangement could be changed. And I didn't mention anything else about it. I did talk to the director with her and told her, explained to her that the person that she was sitting with, my mother was having negative meal experiences and she was actually wanting to skip meals simply because this person had such a negative attitude. And they were able to switch her to another table. But that kind of thing, being able to intervene and offer reassurance and validate that, yes, you know she has a problem and this is what you're going to do about the problem, and then follow through with it and take care of it as best you can. Her meal assignment seating got changed, and now she doesn't have any problem with wanting to go down for meals. But that's just a sign of the things with dementia is they can't handle things as well as they used to, and they are very heavily reliant upon you to handle things for them because they can't process it on how to do it anymore. So, the main thing that has been wonderful for my mother is the structured environment, the daily routines that they have. They know meal times are a certain time. They have a wonderful calendar out there at the facility where she is that has all of the daily activities. She knows that they have exercise classes on Tuesdays and Thursdays, so she makes sure that she goes to that. But as far as games and all of that, she's never been a game person. I've been always the one that loved to play games. But she will love to spend time socializing and being in the exercise class and things of that sort instead of doing the games and things that she doesn't really get into. Now, me, I would be at bingo all the time, but that's just not her. Um, but creating daily routines and structuring the environment is very good for them because it makes it much better and much less confusing for them. And whenever you are dealing with a loved one that has dementia, make sure that you focus on the things that they do that are right. Because you will see it's like a little kid, they just light up. You'll see their face just light up with a smile because they're just happy that they got something right. So that is very important. I can't stress that enough because they get so discouraged when they can't remember and they can't do what they used to do. And it's a very hard pill for them to swallow. So let's move on to the next section about learning about the illness yourself and then teaching other people after that. Here we go. Now, you know, my big go to is the Mayo Clinic for information, and they actually have some really good guidelines for caregivers on their website. They encourage you to speak clearly and simply. Don't tell them a bunch of information at one time because it just bogs their mind. So it's just best just to give them one idea and let them digest it. If you can, point to something to try to explain what you're trying to say. If there's something that you can do this, and I know this is difficult, but try not to rush them in their response. This is the time in your life when you will learn patience, I promise you, because you have to learn patience. You cannot rush them with anything. They get to where that they can't respond in a prompt manner to you anymore because they just don't have the brain function to be able to do that. And it takes an immense amount of patience, but you just have to learn it because I used to pray all the time for patience, and somebody said you need to quit praying for patience because tri- tribulation is what causes you to have patience. Well, after having my father who has had the Lewy body dementia and my mother who's had the vascular dementia, and learning what I've learned from Tipa Snow, I've learned to be very patient. I didn't used to be, but I've learned it just through what I've been through. But it just takes practice, and you have to take your time. You can't rush them. You can't, you have to plan way ahead of time if you have something scheduled because you just can't rush anything. Make sure you encourage them to exercise because it may slow the mental part of their decline, especially if they don't have anything else going on top of it, such as cancer, like my dad did. Like I said, the cancer treatments expedited everything for him with the Parkinson's because of the radiation treatment. Now, encourage them to participate in games and do puzzles and stuff because it helps keep the mind sharp. My mother, I keep her supplied with the word search books because that's what she absolutely loves to do. I can't get her to play bingo with all the little ladies at the assisted living place, which is what I absolutely love to do. But she has no interest in bingo. But she'll sit down in a book and she'll do those word search puzzles just one right after another because that's what she enjoys doing. And they encourage you to find some kind of bedtime ritual that is going to be calming for that person, whether it is reading to them. My father had this thing where he liked to be read to. I think he actually got to a point where he wasn't really able to read due to cataracts closer to the time that he got worse. So at night, he used to always want me to read to him. So, whatever ritual that you can do that can calm your loved one down, a lot of times at night when there is a lot of TV or stuff going on, that can actually agitate and rile them up instead of calming them down. So, whatever you can do to try to make things more relaxing and more calming, I encourage you to do it. For myself, one of the things that I love is just to put on a video on YouTube of just rain. And a lot of times I'll go to sleep listening to the rain. But it's just whatever you can do just to calm your spirit and their spirit so you can relax. You need that precious time because it can really drive your blood pressure up if you can't get enough time to yourself to be able to relax. And if you can't get that person to relax, you're not going to be able to relax. Make sure that you leave on night lights in case they get disoriented. My mother started this thing of wandering at night in the hallway, getting disoriented. So make sure that you leave night lights on. And just remember that no dementia is the same. All of these are different. My parents were just total opposites in the way that their dementia hit them. So these are just some guidelines to help you as a caregiver with your family member that has dementia because it will help give you some peace of mind in the long run. Now, as far as alternatives to conventional medicine, there are some things that you can do to help your loved one. You can find whatever soothing music they like to listen to. I personally like the Soothing Relaxation channel on YouTube that has a lot of Celtic music and things like that. I find that extremely relaxing. You can also think about pet therapy, but it has to be a pet that's calm, not one that's going to rile them up. Aromatherapy is another consideration that they offer, as well as massage is another consideration they offer. Now, with my mother, one of the things that calms her the most, she gets extremely anxious whenever we have to go to doctor's appointments and stuff like that. So, one of the things that I have to do with her is just like you would reward a child for good behavior at a doctor's office, after we get through with the doctor's appointment, she knows that we're going to go and get her a Whopper from Burger King because that's like her favorite thing. So she knows that that's something that she can look forward to after we have a doctor's appointment. With my father, oddly enough, it was a pedicure for him. That was what really relaxed him, was to not have to worry about his feet and having somebody to take care of his nails and stuff for him, because my manicures and pedicures were important because my mom didn't feel comfortable cutting his nails because of all the shaking. And my dad just felt comfortable with somebody else that did that for a living to be able to do that for him. But you have to have somebody that's going to be patient. So make sure that you have somebody that's understanding and going to have a lot of patience that can work with them, because it takes a special person and not everybody has that. So just be mindful of who you take them to and how they act around them, because if a person isn't comfortable around them, or if they make them uncomfortable, then that's not going to be a good person for them to see. So just watch people's actions and the way that they treat them and the way they interact around them whenever you're out, and just pick up on that and make a mental note of it, and you'll be able to figure out what places are good to take them to and what places are best to avoid, because there are certain restaurants and stuff that are extremely noisy that just add to my mother's anxiety. And it's just something that you have to learn in terms of environment, that they just can't tolerate what they used to tolerate. So it's learn as you go. All right. The first thing that I want to talk about is Tipa Snow. She is an occupational therapist that has worked with dementia patients for over 30 years. And she has her own website, tipasnow.com. You can become a member of that. You can take certification classes to get certified in helping to take care of people that have dementia. She has all kinds of videos on dementia that really you need to really take advantage of and learn about what it's like for your loved one to have dementia, because she nails it. She really nails what they go through, and she really puts it in a way that you can understand everything that they're feeling and going through. So please take the time to go to her website, or look up Tipa Snow and look up dementia, because she's got a video that is wonderful about the early warning signs of dementia. There's 10 early warning signs, And then she's got a wonderful video on understanding, accepting, and appreciating a person that is living with dementia. And then she has a video on a scale program that she actually developed herself, and I commend her for that, on the different stages of dementia from when they're first diagnosed all the way up to the final stages when they're close to death. But she has used a scale that's of gemstones, and I think it's just such a precious idea that she has, because she's like, you can't devalue the person because of the illness. They're still a gem. It's just the type of the gems that changes. And the type of gem changes because of the type of the outward appearance, what you're seeing and what they're able to express. So it is remarkable information, and I challenge you to really follow up with her and learn as much as you can from her, because she is a tremendous resource. And I told her that she has done so much for me in helping me to understand what my mom was going through and what my dad went through with his Parkinson's. He didn't really have so much of the bad aspects of the Lewy body as much as he just didn't have time, I don't think, to create a problem with it, because the radiation treatments from the cancer is what did him in so quickly. But my mom, on the other hand, with the vascular, she has been my hands full. So Tipa has helped me out immensely with her, because the dementias are so different between Parkinson's and with vascular. Everything is so different, and you can't treat one like the other, because I never really knew that much about the different types of dementias until I started having to deal with it myself, with both my father and his Parkinson's and his Lewy body that he had 7 years ago, and then her being diagnosed last year with vascular. So between the two of them, these are the ones that I've had the most experience with, and they just happen to be the two that are the most common behind Alzheimer's. So I highly recommend her as an information source, and take in as much information as you can, because this woman is brilliant. And the plan that she has come up with, as far as approaching care with love instead of trying to rush them through tasks, you can't do that with somebody with dementia. And she helps you understand that, because I was actually watching some videos in which she herself plays a dementia patient and responds the way somebody in that stage would respond. And it's just amazing to watch. So I challenge you to really watch her and learn from her videos, because this woman is just a wealth of information, and she is such a blessing to help us to understand dementia patients, because she has worked with them for so long. Without her knowledge and without her resources and her having worked with them so long, we would be lost in taking care of our loved ones. But she does a beautiful job in helping you understand. And it's just a beautiful thing to watch her interact with people. One of the important things that is really important to learn from all of Tipa's leadership and all of her guidance is that these patients experience a lot of a mixture of emotions, and they go through the whole gamut sometimes very quickly. They can be confused, they can get frustrated, they can get angry, they can get fearful, they can get uncertain about things and just start bawling and just crying, have a lot of grief and have a lot of depression, and it takes an awful lot to take care of someone that has this type of dementia, any type of dementia. Um, the main thing that you have to do is just listen to what they have to say, even if it's the millionth time that you've heard it. You listen to what they have to say and you reassure them as best you can. Always make sure you try to help them address the problem because they don't have enough memory function and cognitive function upstairs left to put the steps together to take care of things. Make sure you remain positive and don't be sarcastic or anything like that because they can't comprehend that and can't understand that. Just keep everything simple. Do your best to help them retain their dignity and their self-respect. Make sure you watch them for worsening problems walking with their gait. If they get to where they can't make it with a cane and they're leaning too much to one side, perhaps they need to switch to a walker. If they get to where a walker is not good for them because they feel like their legs are going to give way, maybe it's time to switch to a wheelchair. But just do your best to try to keep them safe. And that can be a full-time job in itself. Make sure that you watch for medication reactions. Make sure any new drug or anything they start them on, make sure you read those sheets that they give you from the pharmacy that say, these are the side effects, this is what it interacts with, and make sure that you watch for those to see if they're having adverse reactions. And make sure whenever you start seeing them having periods of delusion or periods of hallucinations and all, that you are supportive during that time and you reassure them during that time. That it doesn't do any good to tell them that the person is not there or whatever because they're there in their mind. And that doesn't do anything but cause friction. So just do whatever you can to support them through that. Tipa actually has some really good videos about how to handle somebody that is having hallucinations and how to redirect their behavior. So again, I encourage you to look to her for support during this time because she has some wonderful classes that you can take to learn how to better associate with someone that has dementia. It is very important that you, as a caregiver, get as much support as you possibly can to help with your loved one who has Lewy body dementia. You are going to need some relief, so do not feel guilty when you have to ask others to help you. Ask friends or family members for help if you need it. If you don't have anybody that you can ask for help, then definitely look into the local community resources such as the Centers for Aging that you have available in your community. Consider in-home health services to help support the care that you're giving, to augment what you're already doing to make sure that they get the best care possible. Also, you've got to make sure that you eat right and that you exercise to stay on top of your health because they're counting on you to remain healthy to take care of them. Learn as much as you possibly can, and that's why I'm providing all of the links that I have. And do not be afraid to ask questions of healthcare providers. If you have a healthcare provider that does not take the time to explain things to you and doesn't want to take the time, to explain things properly, then you need to get another healthcare provider. I've encountered some that have what I call God syndrome, that don't want to take the time to explain things. And when you encounter people like that, you know that they're just in it for the almighty dollar, and that you need to find someone who truly cares about your loved one as you do. They are out there. You just have to find them. And make sure you join a support group. I can't ask this of you enough, because it is so very difficult to handle all of the stress and the strain that's involved with day-to-day care, especially as they become more and more and more dependent on you for everything. And that's what happens as this disease progresses. So please reach out and get the help that you need and the support that you need to help you with your loved one, so you don't reach a point of feeling overwhelmed, because you can get that way very quickly when they get to where they start relying on you for everything. This really concludes all of the information that I have on this. So we're going to go into getting you some resources, and also getting you to where you feel comfortable sharing your story with other people, because that's where you're going to find strength. And I want to encourage you, as you have experience with dementia, make sure you share your story and your experience with other people, because you're going to find strength in that. And it's going to feel good to you to get reassurance from other people that what you are doing is helping them. Because you'll be amazed when you put yourself out there and you get involved in a group of people. People always end up having ingenious ideas on how to handle things and how to make things less bumpy, because it can be a bumpy road. And I noticed that Tipa works a lot with an organization called Senior Helpers. And I want to encourage you to reach out to them, because I noticed they have a caregiver stress channel. And to me, that sounds like something that would be a good resource whenever we get to feeling like we're ready to pull our hair out. Of course, mine's already turned gray. The only thing that it's got left to do is turn loose. And I certainly hope it doesn't turn loose, because I don't want to be bald. But I highly encourage you to get involved in a support group. Check with your local services for the elderly and for aging. Check with even hospice has volunteers that can come and sit with your loved one to get you to get some time away. And they also have volunteers that can come in and spend time with your loved one, while you take care of errands or whatever you have to do, just to get away for a bit, because you have to get away for a bit. This is extremely taxing. This is not something that you can do day in and day out without having any help. Um, my mom stayed at home. She's 83. She stayed at home until February of this year when she fell. And after she fell, I told her, I said, Mom, it's no longer safe for you to be living by yourself. I understand that you don't want to live with me, because we're both two headstrong women, but something's got to change. And what I did with her is we went around to 5 different assisted livings here in Columbus, and we went to 5 different places. She was able to pick out the one that she liked the most, the one that she wanted to live at, and so it was not a problem. Now, I've seen a lot of people that don't take the time to let their loved one pick where they want to be, and I've seen some miserable folks. So, if you're able to take your loved one out to different facilities and let them pick out the place they want to be, it works out much better that way. Because I took her to the doctor this morning to get some labs drawn since she started all that medicine for her AFib, and she is still as happy as a clam in the facility that she is in, even though we had to make that change with her person that she was with at dinner that was making her so miserable that she didn't want to go to dinner. We got that taken care of, and she is as happy as she can be out there. And she says that she knows that she didn't need to be by herself, and she didn't realize how much she was missing until she got out there and started having experiences and sharing things with other people. So it just goes to show you how much they actually don't realize they're missing when they are by themselves all the time. But she was by herself for 7 years after my dad died. She was insistent that she stay in her house as long as she could, but it just reached a point that it was no longer safe. Please be sure that you share this information with other people that have loved ones that have Parkinson's, that are going to be dealing with the Lewy body dementia if they aren't already. And if you find this content helpful, please remember to like and subscribe to the channel. And if you sign up with Tipa, I have seen her do live sessions, but I don't know if you have to be a part of her actual website to get involved with the live sessions or if she does some on YouTube. But I happened to catch a live session the other day that she was on, and I was telling her that I was sharing her information with the people that follow me on my channel because she does such remarkable work. She is a tremendous resource for y'all to use. Now, remember to share your story. You know, it's developing right now, but just like my story with what I've been through with my parents has helped you, make sure that you share your story with other people to give them encouragement because it makes a tremendous difference to know that somebody else is going through this and has dealt with this and you're not alone. It's just a tremendous feeling to know that someone else has been through it because it is a very difficult journey to take with when you have a loved one that's got dementia. So please, by all means, share this information with anybody that may find it helpful. And the next one that we are going to tackle is going to be Alzheimer's. So y'all look for that one. It's going to be the next one that I do, and I'll have it ready sometime next week. Have a wonderful weekend.